Welcome to Your Family Matters. I'm Dr. Keith Canner here with Amber Canner on RadioactiveBroadcasting.com. And then we've got a fellow by the name of Tal Givoly, and he's going to talk about Medivizor, which is a service for people to help if you've got a serious disorder or serious disease. They help you understand the research involved and kind of guide you along. So it should be a really good show.
It sounds like it, Keith.
Joining us now is Tal Givoly. Tal, you're the CEO of an exciting new service, I guess you would call it, that allows patients or advocates to access world-class medical information that relates specifically to their disease or condition. And I know the mantra of Medivizor is to save lives and empower patients. How do you go about doing this?
Thanks for having me on the show, Keith. And basically, we've all probably seen this either in our own lives or in somebody we've seen, in a relative or friend, that when people become sick with a serious or chronic medical condition, they tend to become researchers. When I say researchers, I mean researching on the web, on the internet, anything that might relate to them, to their condition. And there's a lot of great information on the internet, but very quickly it becomes overwhelming. It's not easy to know what to trust, what's current, what's not a quack and what's based on, real evidence, scientific evidence. The most difficult is what is relevant to my specific situation. People are different and their disease is different. So what we set out to do is be able to personalize the information so that each person gets only the information that's related to their specific situation. Mm-hmm. Now, in order to do this, what we do, we need to ask people a few questions about themselves and about what's going on with them. And so they go in and fill in these questions about their health, about their condition. And the first thing we give them is a state of the art that's specific to their situation. And from that point on, science doesn't stand still. So they continue to get updates from us whenever there's something new. And when I'm saying something new, it could be published research in a reputable medical journal. It could be a clinical trial for which they may be matching. It could be new guidelines on how to treat their situation. It could be tips for lifestyle and so on. All that source material that I just discussed, that could be updated, may not be understandable to most people because it's really designed for researchers. So we even translate it or interpret it, summarize it in a way that anybody could understand mostly.
That sounds extremely valuable. How do people find you to be able to do that?
Well, we're online on the web. It's a new service, actually. A couple months ago, we just launched it in what we call a public beta. And anybody could go to our website. It's just medivizor.com. It's with a Z, medivizor.com. And you just need an email there, and you could sign in. Now, it's free. It's a totally free service, and it's also private. So we don't, share your information with others without your explicit consent.
What are some of the typical cases that you get? Can you share a little bit about that with us?
Sure. So we started out with, I'd say, some of the most serious diseases. We support 88% of cancer incidents, and that includes breast cancer and prostate cancer, colorectal cancer, lung cancer, and melanoma. And those 5 cancers actually are 88% of the incidence of cancer. Then we have diabetes. And we also have 75% of cardiovascular disease. And we continue to add diseases all the time. So in the cardiovascular, by the way, we have hypertension, stroke, and ischemic heart disease or heart attack and other heart diseases. And all the time, we're going to continue to add more conditions as we grow and expand. So even if somebody doesn't have one of these supported conditions, they could go in and sign up and just let us know what condition they're interested in, and we'll let them know as soon as we do support that condition.
One of the things I was thinking about, Tal, and Amber comment on this too, is when people are diagnosed with something, they get extremely anxious. And doing your own research when you're anxious is just not necessarily a really good idea. And it sounds like Medivizor really takes that, that position of really helping a patient be more objective in terms of their condition.
That's right. And it's not just the patients themselves. Sometimes it's a caregiver, if it's for an elderly parent or for a young child. So people could come in and do it on behalf of others. They don't have to do it on behalf of themselves. But we try to cut through a lot of the headlines. So we don't over-sensationalize things. like places you'd find this information if it gets published in the news. We try to boil it down and say, what's relevant? Is it clinically relevant? Is it something that could really affect you? And only give you the information that's relevant for your specific situation, which cuts down a lot on the wasted effort here.
Can you tell us a little bit about how you got into this? I mean, it's fascinating.
Sure. So each of the founders actually had, either seen this on themselves. So one of my co-founders dealt with as a caregiver for his mother that had cancer, like a case manager, and helped her through these things. I saw this on friends of mine and what they had to go through when their daughter had leukemia. Professor Kaplan, our chief medical officer, he basically sees this from the other perspective, where people come in with all these Google printouts. They've misdiagnosed themselves. They got all worked up. And now he needs to spend a lot of the meeting with them just to go through that, and it's irrelevant. So it's very frustrating on both sides.
I was wondering a little bit about how far you expand. Is this an international service, or is this just the U.S.? How does this work?
The service is available on the internet and available for everybody and anybody, but it's only in English, so it's also available for other English-speaking countries. In the U.S. is the prime focus, I'd say, and right now we actually have doctors across the U.S. inviting their patients to join Medivizor. So we have, because they find this, elevates the discussion, and instead of bad information, it gives them good information and just the right information for them. And in fact, also we've got endorsements from the Colon Cancer Coalition, the Colon Cancer Foundation, the Diabetes Hands Foundation, the Melanoma Foundation of New England, and others. And they're endorsing us because basically they see that this is a valuable resource that they can't find anywhere else.
And it's really wonderful. Who does the translation for you? How does that work? What I mean is, like you said, that a lot of people, if you do it yourself, you're going to get very jargony in terms of medical terms and whatnot. But as it goes through your service, who actually does kind of the translation of the information and then gives that to the patient?
Professor Kaplan oversees our medical processes. Then we have about 24 doctors and researchers around the world that review new material as it comes in and interpret it. And there's an internal peer-reviewed process. And basically, that's how it gets translated into 10th grade English. It's about 300 words to summarize the implications of this new piece of information, be it research or a clinical trial. And by the way, in terms of clinical trials, it really exposes you to only those that are relevant for your specific situation, and you could directly apply if you'd like.
What about recommendations? Is that something that you do as well? Like not only providing the information, but can you help the patient find places to get treatment?
That's something that may come later. Right now, we don't yet recommend. We don't provide medical advice. What we do is provide information. Sometimes we would tell you that this is something you may want to discuss with your doctor. Ultimately, you need to make these decisions with your medical team. But it's very valuable information that may or may not get to your doctor. In fact, doctors are overwhelmed today by information themselves. So getting this information in front of them is very useful. You need to know how to talk to them about it, but it could be, life-saving or quality of life improving. So it's very important. Now, I think that one of the things we're trying to do right now is really, just by talking to you, but in your audience, we want to get people to know about Medivizor because we want to help more and more people. That's what we set out to do. Today, everybody knows somebody that could benefit from this service. Just tell them about it.
And I think it's a really, really wonderful service, Tal, and we advocate for you in this. In terms of how many people you've actually helped at this point, do you have some numbers?
We have a few thousand right now. It's not yet in the millions, but it's certainly growing every day. People are joining. People are inviting others. People are discovering us through blogs that they read about us, through shows like your own here. But these are early days, and people are very excited about the service. Right now, 94% of our users recommend us to others. So it's highly appreciated by them.
And it's really a wonderful service. And Tal, we really want to thank you for joining us here on our show, Medivizor. And we really encourage our listeners to check your site out and also, go to your site if you've got a condition where you really need some help. And your service, Tal, sounds like a wonderful, wonderful advocate for patients. And we want to thank you for joining us.
Oh, thanks for having me, and thanks to you all.
We'll be back with everybody next week I'm Dr. Keith Kanner with Amber Kanner here on Your Family Matters on radioactivebroadcasting.com.